Do you have a chronic illness or a medical condition? Or maybe you don't have any diagnosis, but you know that something is off because you have symptoms that interfere with your day-to-day life. Maybe you bloat all the time, or you can't eat certain things without having acid reflux. You're always tired, or maybe you even get things like chronic UTIs and yeast infections, and this is affecting your work, your relationships, and it's affecting your confidence. If that resonates, you probably aren't comfortable living like this. You potentially are looking for solutions actively. So maybe you're thinking of getting coaching or enrolling in a program, but you're also thinking like, hey, but if doctors haven't been able to help me with this medical condition, how can a coach get me there? So if that is you, you're in the right place, because in this video, you're going to discover the 4 key differences between doctors and coaches so you can make the best, most aligned decision for yourself. Full disclaimer, I am a coach myself. I am certified as a nutritional therapy practitioner and as an autoimmune protocol coach. And I facilitated incredible transformations over the years. But just to give you a few examples of this year alone, here's what we've seen. Number 1, a mom of 3 with chronic gastritis was able to stop her PPI and heal her abdominal pain in less than 3 months. Number 2, one of our clients with IBSD, which stands for IBS diarrhea, which is a tendency for chronic loose stools, resolved her bowel movements and low energy in those 12 weeks as well. And number 3, one of our most recent clients had difficulty swallowing. She came with a diagnosis of GERD, and she had this throat sensation that literally resolved within the first 10 days in the program. Now we're focused on her heartburn and in her gastritis, but that was the first symptom that went away. Now, do you know what all of these women had in common? They all had doctors. They have GI doctors, they have ENTs, they have acupuncturists. Most of them have gotten endoscopies before. They have gotten medicine, and they have gotten even dietary recommendations. So you may ask, how or why do women with a full team of care providers still choose to get coached? Well, before I tell you that, I gotta tell you something. Doctors and coaches are so different. We operate in 2 different arenas for a reason. And to explain it to you, I'm gonna need my board. So doctors, they're gonna be here. And then coaches. Okay, so now that we have our doctors and our coaches grid, it's important that you know that each of us have different roles. We have different approaches. We run different labs. And we also give you different action plans. So the whole purpose of this video is for you to discover whether the roles, the approach, the labs, and the action plan that you are currently on are in alignment with you, or if you need to change them. Here we go. So number 1, the role of a doctor is to run medical procedures. So that is doing your endoscopy, your colonoscopy, prescribing medications. Those are all medical procedures. Nutritional therapy practitioners, on the other hand, we help you understand your results and to navigate the system. So what does this look like? We help you advocate for yourself. If you feel a little tense around your doctor, that is normal. We help you make sense of your labs, and also to kind of change your mindset and to help you with that really important context that is so needed. For example, a lot of my clients get medical procedures like endoscopies and colonoscopies, And they get a little frustrated when they come out inconclusive or normal. And I like to tell them, like, hey, a normal endoscopy, nothing in a colonoscopy, those are great things. It just means that nothing major happened, and that is grounds for celebration. Now, let's get to the important work. Now, on their approach, the approach of a doctor is to diagnose. Doctors are diagnostics. They tell you what is wrong. Whereas nutritional therapy practitioners or coaches, we find the root cause. So you can say, like, doctors tell you what, we ask and find out why. Oh, do you get gastritis? Why did you get gastritis? Oh, because you have H. pylori. Why did you get H. pylori? Oh, because you have low stomach acid. Why did you get low stomach acid? Oh, because I'm always stressed. Why are you always stressed? And we go deeper and deeper and deeper, because the deeper we go, the better your action plan will be. Now, when it comes to labs, doctors run your conventional labs, your blood panels, your regular stool test, maybe a breath test, and these is fine. But the problem is when you go and get all of your blood drawn, you do all of these tests and nothing comes out of it. The reason why is because conventional labs, their results are based on the average population, and the average population is sick. 80% of Americans have some sort of metabolic dysfunction or they're in a medication. So you are not getting results based on the optimal ranges. You're not being compared to the healthiest person in the country. You are being compared to the average. Now, us nutritional therapy practitioners, we run functional tests. Functional tests are tests that are more specialized that get to the root cause. In my practice, we run a test called the GI map that is famously good at picking H. pylori. A lot of the times it happens that people get a conventional breath test and they get a negative H. pylori infection, and they run a functional test like the GI map that we run in my practice, and we get a positive result. So naturally, it is important to eradicate that bacteria. So that is just to give you an example. Functional tests are typically better depending on the context, but in the context of chronic issues, yes, because they're going to pick up on things that conventional tests won't pick up on. Now, the last key differentiator between doctors and coaches is the action plan. When you go to a doctor, you typically get general guidelines. They tell you to reduce stress. Maybe they tell you to change your diet, to eat a little healthier. Maybe they tell you to go on a low FODMAP diet or to go gluten-free. But that is where it stops. They just tell you very generally what you should do, not how you should do it, not the context as to why you should do it, but just do it. Whereas the reason why you get a nutritional therapy practitioner is to get an action plan. We are very goal oriented. And more importantly, we're here to solve a problem. So when you enroll in a functional nutrition program, like from a nutritional therapy practitioner, what you are in is not typically for just overall health, for just eating healthy. You're there to solve a problem. If your goal is to eat pizza on Saturday and not be bloated on Sunday, that is a goal that you can work through with a nutritional therapy practitioner. If your goal is to resolve abdominal pain, resolve loose stools, those are goals that you can work through with a nutritional therapy practitioner. Now, I want you to sit with something for a second. I am not a big sports person at all. I don't really know a lot about sports, but this year I've been very inspired by sports. If you know anything about me, you may know that I am Venezuelan, and Venezuela won the World Baseball Classic this year. I'm also half Dominican with New York roots, so I was thrilled when the Knicks won. And something that has me fascinated is that in sports, the best team isn't the team with the best players. The best team is the team with the best coach, because the coach is the one who can see on the outside what you cannot see when you're in it. Coaches watch, they adjust, they push you in the right direction at the right time. And that is what coaching does for your health as well. If everything that I mentioned today resonated with you, it is likely that you may be playing a game alone, and it's time for you to get a coach. Someone in your corner who can help you see what you cannot see, who can give you a strategy that then you can implement and check with them so you can track your progress. Because here's what's going on. Your doctor already did their job. They run the labs, they got your colonoscopy and your endoscopy done, they gave you the medicine. They are continuing to do their job as of right now, because you're probably going to see them in a few months, but it's not their job to help you resolve your chronic gut condition. This is a job of a nutritional therapy practitioner and of a certified coach. So if you want me to be your coach, all the information is in the description below, whatever you're watching this video. But if you're not quite ready to do it yet, I recommend that you watch the video that is right here if you're on YouTube, because it's gonna give you 3 easy steps that you can implement right now so you can start feeling better for free. It also includes a free tool that you can download that I use with all of my clients and my coaching practice. So go ahead, watch the video below, or apply to work together one-on-one. This is Mario Cabral from Gut Therapy. Thank you for being here.